We described the PK/PD properties of anti-infective agents used for STIs, explained the pathophysiology and clinical presentations of STIs, and interpreted diagnostic laboratory findings to confirm the presence of these infections. And we recommended guideline concordant treatment for genital herpes, gonorrhea, chlamydia, or syphilis. Now, let's identify prevention strategies for genital herpes, gonorrhea, chlamydia, and syphilis in sexually active adults. Now, for genital herpes specifically, consistent and correct condom use has been shown to decrease but not eliminate the risk for HSV2 transmission from men to women. Now, condoms are less effective for preventing transmission from women to men. Now, for men specifically, medical male circumcision is associated with decreased risk for HSV2 acquisition among adult heterosexual men, and with decreased risk of HSV2 transmission from male to female partners, so it will benefit both. Now, currently there is no evidence that pre-exposure prophylaxis with anti-herpes antivirals such as acyclovir, valacyclovir, or famciclovir is effective for preventing HSV2. One thing that's interesting in men having sex with men and transgender women, daily HIV PrEP with Truvada decreases the risk for severe ulcers with symptomatic genital HSV2 infection, but not for HSV2 acquisition. So people who are taking HIV PrEP, they can still get HSV2. It's just that their ulcers will be less severe. Now, for chlamydia and gonorrhea, prevention strategies are similar, and the same can be said about syphilis. So essentially, sexually active individuals can decrease their risk of acquiring and transmitting these infections using latex condoms with all sexual activity, including oral, anal, and vaginal sex. So condoms should be used for any route of sexual intercourse, which limits the number, and also limiting the number of sexual partners can decrease the risk, and of course, avoiding anonymous sex. Now, persons treated for chlamydia should abstain from sexual intercourse for 7 days after single-dose therapy or until completion of a 7-day regimen and resolution of symptoms if present. And patients should also abstain from sexual intercourse until all of their sex partners have been treated. And the same is true for both chlamydia and gonorrhea. So, abstinence until treatment is complete, and until all the sex partners have been treated. Now let's take a look at DXYPEP. So in 2024, CDC released guidelines on the use of DXYcycline post-exposure prophylaxis for bacterial sexually transmitted infection prevention. And this is essentially for special population. So only for men having sex with men and transgender women. So essentially people where the sexual intercourse does not involve the vagina. For these patients who have had a history of at least one bacterial sexually transmitted infections during the past 12 months, the guidelines recommend DXYcycline 200 mg once within 72 hours of oral, vaginal, or anal sex, and should offer DXYcycline post-exposure prophylaxis. And this is not to exceed 200 mg per 24 hours. Now, when somebody is prescribed the DXYPEP, the need for the ongoing need for it should be assessed every 3 to 6 months. In other words, if somebody is no longer at risk of getting these infections, there really would be no need for post-exposure prophylaxis. Now, there is no recommendation that can be given at this time on the use of DXYPEP for cisgender women, cisgender heterosexual men, transgender men, and other non-binary persons because of insufficient evidence at this point. Now, because many of these infections can be prevented by condoms, it is important to provide education to patients on appropriate use of condoms. So it is important to communicate that using condoms correctly helps prevent STIs and pregnancy, but doesn't eliminate the risk entirely. Always use male, which is also referred to as external, or female, which is referred to as internal condoms, as well as dental dams for protection during oral, vaginal, and anal sex. Condoms don't protect against STIs spread by skin-to-skin contact, like genital herpes, syphilis, and mpox. And the best way to prevent STIs is abstinence or a long-term monogamous relationship with an uninfected partner. Now, in this slide, you can see instructions on how to use an external condom. And on this slide, you can see instructions on how to use an internal condom. And lastly, here are instructions on how to use dental dams. So dental dams are essentially latex sheets used between the mouth and vagina or anus during oral sex. Now, ready-to-use dental dams can be purchased online. However, if that's not an option, a regular condom can also be turned into a dental dam. So this is instructions that we can provide to our patients. So essentially, a regular condom, if you cut both ends of the condom and then cut alongside of it, it can essentially become an effective dental dam that can protect patients from getting STIs when they are performing oral intercourse. This concludes this presentation.